of the most basic aspect of counseling is listening. It is both basic, at the same time, a most important aspect of counseling. When we allow someone to talk, we are allowing the person to ventilate whatever that is frustrating them, upsetting them. A person who is on the verge of suicide, for example, it can be as simple as wanting someone to listen to them. Once they have ventilated, they calm down, they may completely forget about that suicidal impulse. Listening need not be a monologue. It can be two-way. The first part is we give our caller, our client, a free run. Let them say whatever they want to say.
Even counselors don't make decisions for them, they only help clients make their own decisions. So in that sense, starting off there, it just goes to show how important is it to help or to encourage patients to voice out their opinion, voice out the grief and the problems that may be a primary onset which leads to a secondary depressive mood, or it could also be anxiety or any psychotic symptoms. So that's where I think the Befrienders actually come in. They come in as a non-threatening, anonymous group of people who basically just listen to your problem, don't judge you, don't give you or tell you what to do. But in a way, patients would realize later on that by talking to people, they're basically listening to themselves and they're talking out what they feel, and eventually they come up with some solutions where the Befrienders, basically those are doing online, will help them out, sort of possibly guide them to certain ways that they can actually do better. Now we've seen lots of patients who basically just need a hearing ear, and they don't find that because people shy away, people have no time to talk, but they eventually hear themselves, they hear their own problems, and they come up with a solution to the problem, and that basically reduces the mood, and it does help. It's also help people decide or re-decide on decisions, like for example suicide. I find that the rates are actually quite high, and when people actually talk out their troubles, they come to a solution and they find out that there are multiple other solutions to one problem, not just suicide. And that's where the talking therapy basically helps.
Common mental health problems like anxiety and depression requires common methods of treatment. If we follow Western styles or Western methods of treatment, includes use of many professionals, and when there are many professionals, it involves a lot of training, a lot of resources, a lot of time spent to make people more so-called trained, but the delivery and the accessibility to these professionals again are limited. So that defeats the purpose. The more you have, the less people can see the professionals. So we need different strategies. One of the strategies taken by the Ministry of Health is trying to promote other so-called generic or non-trained, in bracket, non-trained professionals like nurses, lay people, normal people, volunteers, to deliver the help where help is needed. People come in with mental health problems, doesn't mean that they need aggressive intervention. Most of the time it's just a useful time spent, somebody who can listen actively. Basically the skill is just listening with empathy, they call it. Listen with understanding, listen with like a human being who should listen.